Welcome to the deep dive. Today we're plunging into a really critical but often hidden aspect of equine health. Immunosuppression in horses.
Yeah.
Think of it as this sort of silent threat, quietly weakening a horse's defenses and leaving them just incredibly vulnerable. Our mission in this deep dive, it's really to pull back the curtain on this intricate biological system. We're going to uncover its sometimes surprising triggers, reveal how vets diagnose it, and explore the strategies for fighting back. Consider this your shortcut to being truly well-informed about a fascinating biological puzzle, and there are definitely some unexpected twists along the way. So let's start right at the very beginning. What exactly does immunosuppression mean when we're talking about a horse in terms we can all, grasp?
Right. Well, in simple terms, it means the horse's immune system just isn't functioning at full capacity. It's lost some of its ability to mount that protective response it normally would against pathogens.
Okay.
And this leaves the animal much more susceptible to infection. You could almost imagine the immune system as, say, an army defending a castle. Immunosuppression means parts of that army are maybe missing, or they're just not able to fight effectively. It's not always a total collapse either. It can involve specific divisions,
Yeah.
For instance, you've got the innate arm, which is sort of like the immediate instinctual guards on the walls, always ready for that rapid first-line defense.
Yeah.
Then there's the adaptive arm, which is more like a specialized intelligence agency. It learns who specific invaders are, remembers them, and then trains targeted forces. Within that adaptive arm, humoral immunity is all about producing specific antibodies. Think of these as smart, targeted missiles that lock onto threats.
Okay.
And cell-mediated immunity is more about direct combat, where specialized cells physically go after and neutralize infected cells. The key players in this whole army include neutrophils, they're the frontline soldiers, and lymphocytes are B and T cells. They're the strategists and specialized units. Plus, you have soluble factors like immunoglobulins, kind of the communication signals, all working together to orchestrate protection.
That army analogy really does help paint a picture. So if a horse's immune system isn't, functioning optimally, what are the key signs?
Yeah.
What are the red flags an owner or a vet might notice that suggest this army is compromised?
Yeah, the biggest red flags are usually those recurring infections. That's a big one. You might see repeated bouts of pneumonia or issues with their gut like enteritis, septic arthritis, maybe persistent skin infections. Another major clue is opportunistic infections. These are caused by pathogens that normally wouldn't make a healthy horse sick, things like Candida albicans or Cryptosporidium spp. It's like the weaker army can't even fend off the minor skirmishes,
Right.
You'll also often see a poor response to standard treatments for those infections, or just a general failure to thrive, poor growth, maybe significant weight loss, a persistent fever, but you don't know where it's coming from. That's another warning sign. And sometimes you'll even see a systemic illness after an attenuated live vaccine, or just a failure to respond immunologically to vaccinations at all. It shows their system can't even learn from a drill, so to speak.
Wow. Okay. That list, especially the opportunistic infections, really underscores how vulnerable these horses can become. It makes me wonder, just thinking practically, what's the most common scenario you see leading to immunosuppression? Are there, one or two big culprits that often surprise owners?
That's a really good question, and it brings us right to the why behind this weakened state. Broadly, the causes fall into two main categories. Primary, which are inherited genetic issues, and secondary, which are acquired during the horse's life. And to answer your question directly, those secondary acquired causes, they are far, far more common. And yes, some of them can be quite surprising. Now, on the inherited side, these are genetic defects the horse is born with. The most well-known and frankly devastating example is severe combined immunodeficiency, or SCID, mostly seen in Arabian foals.
Right, SCID. Heard of that one.
Yeah. It's an autosomal recessive defect, meaning the foal has to inherit a copy from both parents, and it's just a complete catastrophe for their immune system. It leads to a total absence of functional T and B lymphocytes, basically. Their army has no specialized units, no strategists.
Oh.
So foals are born seemingly healthy, mainly because they're protected by those maternal antibodies they get from the mare's first milk, the colostrum. But as those antibodies naturally wane, usually by about 2 to 5 months old, the foals just succumb to opportunistic infections because their own immune system can't take over. And sadly, there's no effective treatment. So prevention through genetic testing of breeding stock is absolutely paramount. It's the only real way.
That's incredibly tough.
It is. Beyond SCID, there are other primary conditions, though they're much rarer. We sometimes see X-linked agammaglobulinemia, XLA, which mainly affects B cell development, so very few antibody-producing cells. There's also selective IgM deficiency, where just one type of antibody, IgM, is low, and Fanconi syndrome, or FIS, another autosomal recessive one, also leading to a B cell deficiency and often anemia.
Fanconi syndrome, right.
And then for older horses, sometimes we see something called common variable immunodeficiency, CVID. It's a more diverse group of disorders causing low antibody levels, often popping up later in life. While these are less common, knowing they exist helps vets pinpoint those, truly rare genetic cases.
Okay, so we've covered the genetic side, but you mentioned that the acquired causes are way more common, and I suspect some of these might genuinely surprise people. What are some of the biggest, maybe unexpected ways a horse's immune system gets compromised after they're born? Here's where it gets really interesting.
Absolutely, yeah. This is where we see the vast majority of cases. And one of the most common acquired issues, especially in newborn foals, is failure of passive transfer, or FPT.
Okay.
It's simply when the foal doesn't get enough or doesn't absorb enough colostrum, that vital first milk from the mare that's packed with maternal antibodies.
Right, that liquid gold.
Exactly. Without those critical early immune reinforcements from mom, the foal is left incredibly vulnerable right from the start. Then there's stress. And I mean chronic stress, physical or psychological. This significantly dampens the immune system. Why? Because it triggers the release of elevated cortisol. Cortisol is necessary in short bursts, but when it's chronically high, it acts like a brake on the immune system, suppressing immune cell activity.
So what kind of stress are we talking about?
Well, think about environmental stress, extreme heat or cold, poor housing, maybe overcrowding, or management stress, like weaning a foal, which is hugely stressful, long-distance transport, intense training for performance horses, even the pressure of showing. And then, of course, physiological stress, chronic pain, trauma, surgery, or any ongoing chronic disease. All these things can quietly chip away at a horse's immune defenses over time.
It really sounds like just being a horse can be a pretty stressful job sometimes. For owners listening, if their horse is, say, a high-performance athlete under intense training, what are some practical, proactive steps they could take to maybe mitigate some of that stress-induced immunosuppression beyond just, giving them a day off?
That's a great practical point. Beyond adequate rest, it's really about optimizing their whole environment and routine. Things like consistent feeding schedules, trying to avoid abrupt changes in their social groups if possible, ensuring good ventilation and appropriate temperatures in their stalls, and being absolutely meticulous about pain management. Even simple things like ensuring they get enough turnout time can make a big difference in reducing stress levels.
Okay, makes sense.
Another huge factor is malnutrition. If a horse is deficient in essential nutrients, protein, specific amino acids, certain vitamins like A, C, E, B complex, or minerals like zinc, selenium, copper, their immune cell function and antibody production can be severely impaired. And what's really fascinating here, and often quite surprising, is that horses with protein-calorie malnutrition seem to be more commonly affected by bacterial diseases rather than viruses.
Oh, interesting. Why is that?
Well, the thinking is that bacteria can more easily survive and multiply in the sort of compromised tissues of a malnourished host, whereas viruses typically need healthier, metabolically active host cells to replicate effectively. And it's not just being underweight. Severe obesity can also be a nutritional trigger for immune dysfunction.
Got it. So nutrition is key, both ways. What else?
Infectious diseases themselves can cause immunosuppression too. Viral infections like equine herpes virus, EHV1, or equine infectious anemia virus, EIAV, can directly damage immune cells or suppress their responses, essentially weakening the army from within. Chronic bacterial or fungal infections can simply overwhelm the system, leading to exhaustion of those immune cells. And heavy parasite burdens, they cause chronic inflammation, which diverts valuable immune resources away from other potential threats.
So the body's fighting on too many fronts.
Exactly. Then there's neoplasia or cancer, especially cancers of the lymphatic system, like lymphosarcoma or multiple myeloma. These can directly impair immune cell production or function, or sometimes even produce abnormal proteins that interfere with normal immune responses. It's like having a rogue faction inside the army disrupting things.
Right.
Metabolic and endocrine disorders also play a significant role. Pituitary pars intermedia dysfunction, PPID, what most people call equine Cushing's disease. That's a classic example.
Yeah, okay, sure.
It leads to chronically elevated cortisol levels, which, as we already talked about, causes chronic immunosuppression. Insulin dysregulation can also contribute to systemic inflammation and impact immune function, making the whole system less efficient.
Okay.
And we absolutely can't forget about immunosuppressive drugs. Things commonly used, like anti-inflammatory corticosteroids, dexamethasone is a prime example, are incredibly potent immunosuppressants, especially with long-term or high-dose use.
Very common drugs, too.
Very common. And chemotherapeutic agents used for cancer treatment also target rapidly dividing cells, which unfortunately includes essential immune cells. These drugs are necessary for certain conditions, but they absolutely come with that inherent risk of weakening defenses. Aging, too. We call it immunosenescence. It's just the natural decline in immune function that happens in older horses, typically those over 20. Their immune system just becomes less responsive, makes them naturally more susceptible to infections, and often less responsive to vaccinations. It's simply time weakening the Army's overall strength. And finally, there's a category of traumatic and toxic causes, which is, frankly, particularly eye-opening. A severe burn injury, for instance, can itself cause profound immunosuppression, leaving the horse really vulnerable to secondary infections.
Wow.
And then you have these hidden environmental toxins, things like cadmium, DDT, dieldrin, lead, methyl mercury. Certain plant toxins, like from hairy vetch, can also induce it. And maybe especially concerning are mycotoxins, things like aflatoxin and trichothecene. These are produced by fungi found in moldy grain or feed.
Mycotoxins, right, in feed.
Exactly. And these can subtly yet significantly depress various immune functions. It's quite a revelation, I think, that these hidden elements in the environment, even in the feed bin, can quietly undermine what seems like a robust immune system. Really highlights the importance of thorough environmental and feed assessment, not just looking for obvious diseases.
Wow, expert, that is an absolutely staggering list of potential culprits for acquired immunosuppression. It really underscores just how many different factors can influence a horse's immune health. It seems like so many everyday things can potentially chip away at that immune system. Given such a wide range, such a variety of causes and symptoms, it sounds like diagnosing immunosuppression in a horse must be like being a detective. What's the typical investigative journey a vet takes to truly piece this complex puzzle together?
You're exactly right. It really is a detective story. It's a multi-pronged approach. You combine careful observation of the clinical signs, a really thorough history, and then specific lab tests to confirm things and hopefully pinpoint the cause. So the first step is always that clinical history and the physical exam.
Okay.
Vets are looking for those recurrent or opportunistic infections we talked about, a poor response to previous treatments, or that general failure to thrive. They'll consider breed predispositions like Arabians for SCID and the age of onset. FPT and SCID usually hit neonates or young foals. They're also assessing all those environmental factors, stressors, housing, nutrition, and critically, any recent drug history, especially if immunosuppressive meds have been used.
Right, putting all the pieces together.
Exactly. Then we move to the lab diagnostics. General tests usually include a complete blood count, the CBC. Gives us a snapshot of the blood cells. This might show lymphopenia, a low lymphocyte count, meaning some of our key immune strategists are low. It's often severe in SCID. Or it might show neutrophilia, suggesting ongoing bacterial infection, and sometimes anemia. Serum biochemistry can reveal things like hypoproteinemia, low protein, suggesting chronic disease, or elevated fibrinogen, or serum amyloid A, SAA, which are markers of inflammation. Urinalysis and fecal exams are usually done too, just to rule out other things like urinary tract infections or heavy parasite burden.
Okay, so those are the baseline tests. What about more specific immune tests?
Right. For more specific immunologic tests, we have serum immunoglobulin quantification. Radial immunodiffusion, or RIB, is kind of the gold standard for measuring IgG, IgM, and IgA levels. This is absolutely crucial for diagnosing FPT in foals, where you're looking for IgG levels below 800 milli-GDL, usually measured around 18-24 hours after birth.
So RD is like a precise measuring cup telling you exactly how many of those antibody protectors are actually circulating, especially critical in those first hours.
Yes, precisely. It gives us that quantitative measure. There are also ELISA, or turbidimetric assays, that are used for more rapid IgG screening, giving a quicker, maybe less precise, but faster answer, especially useful for full site testing.
Gotcha.
Then there's peripheral blood lymphocyte phenotyping, using a technique called flow cytometry. This gives us a much deeper look. This test actually quantifies the specific T cell and B cell subsets. It's crucial for diagnosing conditions like SCID, where you'll see a complete absence of both B and T cells. It also helps diagnose XLA, showing an absence of B cells, and Fanconi syndrome, which is characterized by that B cell lymphopenia.
So flow cytometry sounds incredibly advanced. Is it almost like taking a highly detailed photograph of every single immune cell type in the blood, letting vets really see what's missing or maybe misbehaving?
That's a perfect way to put it, yeah. It identifies and counts very specific types of immune cells based on markers on their surface.
Okay.
Then, of course, there's genetic testing. It's available for SCID in Arabians, which can identify both affected foals and carriers of the gene, and also for Fanconi syndrome. This lets us look for the fundamental genetic flaw itself. And finally, we can assess vaccine response. You measure antibody titers before and after vaccinations, say, to tetanus toxoid. This directly checks the horse's immune competence, how well their army can actually learn to fight a specific threat.
Okay, expert. So once the detective work is done, we have a diagnosis. What can actually be done to help a horse with a compromised immune system? What's the game plan then?
Well, the treatment really is highly dependent on the underlying cause. That's the key message. For those primary inherited immunodeficiencies, the outlook can be, well, challenging. For SCID, as we discussed, there's currently no effective treatment. Affected foals are sadly often euthanized, or they succumb to infections as their maternal antibodies fade. This is why prevention through genetic testing of breeding stock is just so paramount. It's really the only effective approach there.
Such a tough situation.
It really is. For other conditions like X-linked agammaglobulinemia and selective IgM deficiency, management often involves prophylactic, meaning preventative, or long-term antimicrobial therapy to try and control those recurrent bacterial infections. Plasma transfusions or intravenous immunoglobulin, IVIG, can be options to provide passive immunity, essentially giving them a temporary infusion of antibody soldiers.
Right.
But they come with significant challenges like high cost and sometimes limited availability. For common variable immunodeficiency, CVID, horses often need lifelong antimicrobial therapy and really regular monitoring. And it's usually recommended to use inactivated vaccines only. Their antibody response might be suboptimal anyway, and modified live vaccines are generally contraindicated because their weakened system might not handle even an attenuated virus properly.
Okay. So if it's an acquired issue, which as you said is far more common, what's the first line of defense there? What's the cornerstone of treatment?
The absolute cornerstone for acquired immunosuppression is always identify and address the underlying cause. You have to fix the root problem. So for failure passive transfer, FPT, if the foal is very young, ideally under 12, maybe 18 hours old, oral colostrum or colostrum replacers can be given. If they're older than that, absorption isn't great, so intravenous plasma transfusion is the way to go, aiming for an IgG level above 800 milligdl. And prophylactic antibiotics are often used alongside this until we know adequate passive immunity is established.
Makes sense. To get those antibodies in one way or another.
Exactly. For stress-induced immunosuppression, management revolves around providing that clean, comfortable, low-stress environment. Reducing workload or travel, carefully managing social groups, and crucially, addressing any underlying pain. If malnutrition is the issue, it's about meticulous dietary correction. Specific supplementation to address any identified vitamin or mineral deficiencies. And this isn't just about, throwing more feed at them. It's often a very precise process of identifying specific nutrient shortfalls and rebalancing their entire nutritional intake, sometimes over a long period, to truly rebuild their immune foundation.
Right, a tailored approach.
Yeah. Very tailored. For infectious diseases or parasites, you need aggressive, targeted antimicrobials, antibiotics, antivirals, antifungals, whatever fits the specific bug, and a robust deworming program based on fecal egg counts and vet advice. If neoplasia, cancer is the cause, treatment depends heavily on the type and stage, maybe surgery, chemotherapy, other options. Metabolic disorders like PPID, manage with pergolide to control those cortisol levels. Insulin dysregulation, managed through careful dietary changes and appropriate exercise. For drug-induced immunosuppression, the goal is usually to gradually reduce or even discontinue the problematic immunosuppressive medications, if that's clinically feasible, while keeping a very close eye out for any opportunistic infections popping up.
Okay.
And for our older, aging horses with immunosenescence, it's about optimal nutrition. Maintaining appropriate vaccination schedules, although their response might be a bit blunted, so sometimes more frequent boosters are considered, and just really comprehensive preventative health care.
That all makes perfect sense. Address the root cause, whatever it may be. But what about those things like immunomodulation or immunostimulants. Are these ever like a magic bullet that can just boost the immune system regardless of the cause?
Yeah, that's a common question. It's important to understand that these are generally considered adjunctive therapies only, meaning they support other primary treatments. And the scientific evidence for their broad efficacy is often, well, quite limited. They are definitely not a substitute for addressing the underlying cause.
Okay, so not a magic bullet then.
Not really, no. Examples you might hear about include things like Propionibacterium acnes extracts, various beta-glucans, maybe prebiotics and probiotics, or even interferon alpha. But it's really crucial to stress that you should always, always consult with a veterinarian before considering any of these immunomodulatory agents. Their use needs to be carefully evaluated for each individual horse and situation.
What an illuminating exploration into the equine immune system.
Hmm.
Seriously, we've journeyed from understanding the basic definition of immunosuppression to unraveling its really intricate primary and especially those secondary causes, particularly those surprising acquired factors we discussed. And then exploring the sophisticated diagnostic methods and finally looking at the targeted treatments. It truly highlights the sheer complexity and interconnectedness of the immune system in these amazing animals.
Indeed. And effective management of immunosuppression in horses, it really requires that diligent diagnostic approach you mentioned. It's about carefully considering, is this primary or secondary, inherited or acquired, and then developing a truly targeted treatment plan that gets to the root of the problem, all while providing comprehensive supportive care. It's really a testament to how finely tuned these biological systems are and how many different pieces have to work together just right for optimal health.
Yeah. This deep dive into horses really highlights how many different factors, things we see and things we don't, can impact something as fundamental as immunity. It really makes you think about how incredibly intricate biological systems are, not just in horses, but in everything, and how much there still is to learn about optimizing health in every living thing. Kind of makes you consider what aspects of your own environment or maybe your daily routine might be subtly influencing your well-being in ways you haven't even considered. Something to think about. Thank you so much for joining us on this deep dive, and we really encourage you to keep exploring and keep learning.